Hello everyone. This paper is a 4 years follow-up of full pulpotomy in symptomatic mature permanent teeth with caries pulp exposure using a stain-proof calcium silicate-based material. It was done by a Jordanian group and it was published in Journal of Endodontics in 2022. The aim of this study was to assess pulpal and restorative outcome of pulpotomy in symptomatic mature permanent teeth with caries pulp exposure over 4 years. A total of 109 teeth in 90 patients aged between 14 to 60 years received full pulpotomy. All of these patients were healthy and had a restorable mature permanent molar tooth with deep caries and vital pulp, either reversible or irreversible pulpitis. A numerical rating from 0 to 10 and visual analog scale questionnaire were used to record pain intensity before treatment, and the scale was categorized as 0, no pain, from 1 to 3, mild pain, from 4 to 6, moderate pain, and from 7 to 10, severe pain. Teeth would be excluded from the study when hemostasis was not achieved within 10 minutes or when bleeding was not confirmed from all canal orifices. After pulp exposure was confirmed, the cavity was flushed with 2.5 sodium hypochlorite, and then full pulpotomy was performed by removing the entire coronal pulp tissue using a high-speed diamond burr to the level of the canal orifices, and bleeding from all canals orifices was confirmed. Hemostasis was achieved by gentle pressure with a cotton pellet soaked with 2.5 sodium hypochlorite for 2 minutes and repeated if required. Then a non-staining calcium silicate-based material was used here in this study, the new NTA Plus, as a capping agent and placed after mixing the powder and gel according to the manufacturer instructions, and it was packed in a thickness of 3 millimeters. After that, a thin layer of light-cured Vitrabond was immediately placed over the material and cured for 20 seconds. The clinical and radiographical evaluation were completed at 6 months, 1 year, 2 years, up to 4 years, and the outcome was considered successful if no clinical signs and symptoms of pulpal pathosis were detected. Also, when no pathosis was evident on the recall radiographs, such as root resorption or new furcal or periapical bifurcation. And finally, when a complete radiographic healing at 2 and 4 years, or a reduction in the periapical index score at 1 year. And the case was considered to have an endodontic failure if there was pain, swelling, or new lesion was formed, and considered as restorative failure if extraction was done or post-space was provided for retention of the core material. The result for this study, the cumulative survival rate for treated teeth over the study for up to 4 years was generally high, started with 98% in 6 months and decreased slightly to 97% in 1 year, and also decreased to 93% in the 2 years, and this number dropped in the 4 years follow-up and reached to 83.8%. Things are to mention in this study. The previous diagnosis of teeth, either reversible or irreversible, showed no significant difference in the outcome of the two diagnostic categories. Also, there was no significant difference in the mean survival rate among the different age groups. And the correlation between bleeding and inflammation of the pulp is still unclear. Several authors suggested that pulpal bleeding can be used as a clinical indicator of pulpal inflammation. And thank you.